Now then to Thrive's patron and also the president here of the Royal College of Physicians, Sir Richard Thompson.
Thanks very much, Kathy. I'm Richard Thompson here at the college, and it's a great pleasure to welcome you all here in the last building that Dennis Lasland, who built the college, he built this extension of the council room, which I think is a lovely room, and a lecture theatre down below where I've just been opening another conference. And it's a particular pleasure, therefore, that you come here and had your conference here. As you know, I've been very keen, as Kathy's hinted, in research. So that I've been with Thrive since 2001, and I think to convince certainly the medical community and everyone else, it's very important to have hard evidence that the things that we're talking about work, and I do believe they do work. St Bernard, of course, was very keen, as you know, and I remember my father, we used to live in Virginia Water, and he said when I was a medical student, the people who were in the large mental health sanatorium there at Virginia Water, they should get out and dig fields, and there's a young medical student, oh, the dick, silly old fool, reminds me of Mark Twain thinking that his father learnt an awful lot between the age of when he was 14 and 21. But he was right, of course. There's clear evidence that physical exercise and getting out do improve people. So I'm an enormous supporter of Thrive, and it does seem, as Kathy has implied, that the way we're riding on a wave, that we're gradually convincing people. I was always impressed when I read the literature. So much work is done elsewhere across Europe. There are all these green care farms, which you don't seem to have in this country. A lot of the basic research behind the advantages of gardening in its widest sense has come from America, starting with Roger Ulrich, showing that even looking at green spaces is important both for hospital patients. They do better after surgery, and it's cholecystectomy, that is gallbladder operation, do better if they could see out of windows and look at green things. And even a study, as you probably know, in prison, that the prisoners who looked at green space through their windows opposed to those cells looking on the prison yard actually went less to the healthcare services of that prison. So it's these sort of really counterintuitive results that are very important to study scientifically. So we've really got to look at the evidence. And there's even evidence that if you look at a variety of plants rather than just one or two, you can improve the benefits. As you know, Mind is a great supporter of some of the things that we're very keen on. There's clear evidence it does improve a whole lot of mental health problems, from combat stress to anxiety to depression, etc. And as we're going to hear from dementia, I'm actually delighted to hear that it's been successful. I always thought it would help. A poll by Maury showed that 94% of the population prefer these sort of complementary alternative treatments, which I lump social and therapeutic gardening into. They prefer those to drugs for mental health problems, and I think we'd all agree with that. And indeed, as you probably know, in recent years a lot of criticism has been produced against psychiatric drugs because they're not always that effective, and we well know they have a lot of side effects. So if we can provide an alternative, in this case a relatively cheap and safe alternative, surely we should support it. Well, the other point I want to make is a tremendous emphasis now on exercise. Much to my surprise, the evidence shows that exercise is more important than being overweight, if you see what I mean. That if you exercise and you're overweight, you can counteract the deleterious effects of being overweight on everything from diabetes to cancer. So we now begin to think that physical exercise is extremely important. And as you know, I know as a gardener, that it is quite considerable exercise. I remember some years ago Thrive produced the figures, the amount of calories used when you're raking and digging. There is in fact a gym outside your window, which of course is relatively cheap. And so the exercise you can take in gardening is extremely important, and I think we should see that as a real benefit both to physical and to mental health. But we mustn't forget that it increases social inequality, because usually people in the social class form 5 don't easily have access to gardens. There are of course allotments, all those sort of things, but on the whole, like gyms and everything else, we're talking about people, the better off people in society who have easy access to gardens. Thrive did a survey a few years ago looking at people with disability, and the majority of them actually wanted access to gardens and had access to gardens, but nevertheless there's a large minority who find that difficult. And I think it's something, again, that we should try and encourage in the community. And Thrive, as you know, has done a tremendous amount at Reading and now in Battersea. So there is a gym outside your window. Get out there and use it, not just to escape from your wife harassing you, but also to get the physical and mental benefits. I've mentioned those, and of course the advantage of people who are isolated in life to get out, and coming to the Reading, the Thrive main centre near Reading. It's quite clear that people got out from an isolated life, living in a single room, they get out to meet people. That was very important, particularly if they had learning difficulties, they were integrated more, meeting people. There was evidence from the studies we did showing that numeracy and literacy could be learnt in the courses that they did. You of course can produce better food, and if you've got your own allotment, etc., produce more high quality food, which must be important. If you get out in the air, you get more vitamin D from sunlight, and vitamin D is not just bones, we now know. Vitamin D is very important in cardiovascular disease, possibly mental disease. And I have a pet theory that I worked for a while at Thompson Young Offenders Institute on, I may say I worked there rather than was an inmate. And looking at the prisoners, they never got any sunlight at all. They went into their exercise yard, went to smoke, but it was outside of the sunlight. So unless they were doing gardening around the prison, they had no exposure to sunlight at all. As you know, normal people, vitamin D levels fall during the winter, so I can't imagine what their vitamin D levels are, but I'm told studies are being done, because I have this image that if you fed vitamin D supplements to prisoners, they'd suddenly all become Christians and change their life and become good. But anyway, the evidence will be coming. And finally, we mustn't forget employment. We always hoped in Thrive, many of the people on the programme would move into employment. In the gardening field there are opportunities, horticulture and agriculture, so we did hope, and we certainly encourage people to take NVQs and so on. It is, I think, I would say, a form of rehabilitation, which has never been well supported in medicine. It used to be part of rheumatology, and rheumatologists became much more specialised, and they're actually holding a conference downstairs from where I've just come. But rehabilitation has been rather neglected, and I think this is part of rehabilitation that we should support. Now, I remember, Kathy, that you did some work with visually disabled people. There was a Blind Garden of the Year competition. I remember going to the results. I was stunned to see these pictures of gardens, beautifully neat and far, far better than mine, by people who were totally blind, apart from just being visually disabled. And also, we had Come Gardening magazine, and I hope that's still going. It's very important. So here's a particular group, disadvantaged people in our society who can be helped by horticulture. I'm greatly looking forward to Joe's 2 lectures about to give us. He's patiently worked with Thrive, struggling uphill to get funds and to do research and to show that social horticulture really is a worthwhile thing. And so all thanks to him, and it's delightful to see him, even though his hair, I notice, has turned slightly more white, but maybe that's because he went out in the sun or what. This programme, I'm told, is also to welcome Growing for Life and Insight, which I'd like to do myself personally. I think it is very good, and the Insight is going to be a measurement outcome tool. I think it's so good we can show that things have changed positively, or indeed negatively. Maybe we should always have the null hypothesis that what we're doing is not good, but show that it is good and then push it. We certainly need more evidence, and I would strongly support that. Last year I went up to Sandwell to see the programme there with John Middleton's public health doctor, which is agriculture in the community, and again a very deprived community. So that was very positive as well. And finally, I'd like to thank Sustain, who I know are supporting this conference today, and I do hope all goes well. It's very important, and I hope we'll be writing up the results that we can use. So thank you very much, Kathy, for asking me.